and how important your LOR really is. So, what makes your elective successful? For me personally, a successful elective is when you don't just show up and observe, but you're actually participating.
So when you work with me, that gives me the opportunity to see how you all work in that setting and then report back to a program director that.
But how Sarthi contributed to my journey in this in form of USCEs and LORs would be that it set a pathway to.
So the thing is that if you want to start the telerotation, my advice is just to read about what other applicants commented in the profile.
In their life, they've never done any peer reviewed work, which I think is a systems problem because
if you have done maybe 6 months to 1 year, there are times when you do research rotations. All right, welcome everyone. Welcome to the webinar from USMLE Sarthi. This is the Sarthi team, and today you will hear from several of the students, Sarthi students who have done rotations, maybe are match students, and I also am trying to get the faculty, the preceptors on, because the topic for today is twofold. So one is US clinical experience, what actually works in US clinical experience, and what the preceptors think students need to improve. What type of students actually don't do well in US clinical experience? So that's one agenda topic. And the second agenda topic, which is very important for all of you who are going into the match, whether this season or next season, is LOR, so letters of recommendation. So as you know, letters of recommendations can actually make or break your USMLE journey. So letter of recommendation, what are the types, what are the most powerful letters of recommendations, and what should you be focused on as you get the letters of recommendations? That is something that we want to talk about, because it not only summarizes your skills and experiences, it plays a crucial role in your journey because it is the third party validation of your skills, and the PDs actually like to read the letter of recommendation. Now what happens is, a lot of times IMGs are actually asked to either write their own letter of recommendation, or they can see the draft of their LOR. So towards the end of it, we'll also do an exercise. We will review a draft LOR, and we will see what is good in that LOR and how that LOR can be improved. So that is the agenda for the meeting today. But let me, obviously we have our student speaker, so I don't want to take too much time talking about it, because I know they all are very busy. So I will, go with speakers first, and then in between, I will also talk about what you can do and how we can help, and so on and so forth. So Anupriya, are you there?
Yes, I'm here.
Okay. So thank you, Anupriya, for joining. If you can get your camera on and introduce yourselves, and then talk about your experiences.
Hi, Pavan sir. It's great to be here. The thing is, I just got operated on a week back for an emergency appendectomy. But yeah, but it was so it's a pleasure to join and give back to the community from which I've learned so much. So I am here. So unfortunately, I'll not be able to switch on my camera.
That's
If
fine.
that's okay.
Yeah, that's okay. Yep.
And so I have prepared for a match. I applied to the match last year. However, I didn't get matched. But my course of journey has changed since then. But how Sarthi contributed to my journey in this in form of USCEs and LORs would be that it set a pathway to to guide me to in order to approach the right USCs that would align with my profile. So I'll be talking about that. The first thing is what comprises a good LOR. So when it comes to a strong LOR, I would say that it has three components. The first is the specificity. The second is the context, and third is the enthusiasm. The specificity here, I would say, would be that a generic cookie cutter sort of a letter simply doesn't stand out. So a strong LOR is when an attending highlights your specific examples of your strengths. So could be your clinical skills or your ability to think critically under pressure, your interpersonal communication with the patients. So here they need to provide anecdotes that that paint sort of a picture of you in action with your unique qualities and how you can be an asset to their residency program. The second component is the context. So, the a great LOR wouldn't just say that X is a great student. It goes beyond that, and it would also demonstrate the fact that how do you stand out than the rest of the cohort. So, are you described as the most diligent student in a highly competitive environment? So, these nuances make a letter more impactful. And lastly, and it's not the least in my experience, is the enthusiasm of that attending. That sets the tone of that letter, which matters as much as its content. That is, it should come across as a genuine endorsement, I would say, whether the attending is enthusiastic and passionate about your potential. So the letter should leave no doubt that the attending believes you will be an outstanding resident. So these are the three components of, I think, in my opinion, would comprise of a strong LOR. And coming to how to approach attendings for a strong LOR, now this is a bit tricky because when it comes to approaching attendings for LORs, I would personally recommend taking a thoughtful and strategic approach because one of the most important things I learned during my time while doing USCEs and being there during that time was that building a genuine relationship with your attending takes time. When especially when you're doing a 1 month of a rotation, it might take a couple of weeks, to set that tone with your attending. So rather than immediately focusing on securing a letter, the thing here is to focus on creating value while you are there. So be proactive in contributing to patient care or asking insightful questions and demonstrating your commitment to learning. This would show your attendings that you are genuinely sort of invested in the work and not just seeking a recommendation. And then after a couple of weeks you can always go to your attending, and once you come across as somebody who is reliable, hardworking and inquisitive, and that would have already built the natural rapport interest, you can always go and softly ask your attending that you are applying to this and this program, or you are interested in this and this sort of branch in internal medicine. What are your future plans? That would help him construct a letter of recommendation that would encompass you as a person, as a resident, and also how you will contribute to that particular residency program in the long run. So I would say these are some of the points that one should keep in mind. And the third thing, and it's not the last thing, but it's very important, that give your attending some time while you ask for the LOR. It shouldn't be like that you have to apply 2 weeks later and you tell him to hurry up the LOR. You should give him time and the space, follow up with them, and at least as a sort of respect and a thankful note, always thank him after he delivers you or he gives you that LOR, that you are really sort of grateful for doing that rotation and for that LOR. So this is from my side.
This is excellent. Very, very good tips on, how to approach for LORs, what actually to do in a rotation and create value. So excellent. Thank you. Thank you very much, Anupriya. Appreciate your time despite, what you had to go through. So appreciate it. And thank you very much.
Thank you so much. Thank you.
Thank you. Before we move on to the next speaker, I do want to, let you know that we will take questions. So I am seeing questions. So yes, there will be a Q&A at the end, and I will take questions. And I do see a few people here who have just joined MBBS and they are interested in USMLE. So always great to have you. Okay. Then I think our next speaker is Gunjan. So Gunjan, welcome. And why don't you talk about your telerotation experience because you could not get visa. So introduce yourself and let's talk about your telerotation experience.
Is Gunjan and I'm from Gujarat. So I joined telerotation through USMLE Sarthi. My first telerotation was under Dr. Lubna Mirza. And my second telerotation was under Dr. Vinod Nukula. So both of them were excellent. Both of them are totally different, but yet very good for any applicant. For example, Dr. Lubna taught so many diseases, and mainly she taught everything which is relevant to medical field or which is relevant to residency or it's related to mainly internal medicine. Why Dr. Nukula taught how to speak with others, how to prepare for interview, how to publish a research, and how to ask a letter of recommendation from the any preceptor under which we are doing observership. So it's more about a practical aspect of the USMLE journey. So my own experience is very, very great under both of them.
Okay. And Gunjan, what is your tip for students who are unable to get a visa? So should they go for telerotation or what do you think?
Telerotation is a very good idea to compensate about the visa limitations. So for IMG, it's a blessing. Yeah. So, but it's not same as the in-person rotation. But yeah, you can definitely consider telerotation at any days rather than doing nothing. To do something is better than doing nothing.
Any other tip, Gunjan, that you may have for the students?
Yeah. So the thing is that if you want to start the telerotation, my advice is just to read about what other applicants commented in the profile or just ask any of your colleagues. So you will land it in a very good rotation. Yeah. So
thank you very much, Gunjan. Appreciate your time. Thank you. Let me take a couple of questions that I see. So you can all put these questions in the chat. So the first question is 3 LORs enough or 4 are required? So the requirement is of 3 LORs only. However, depending on your profile, depending on your, maybe you have low scores or other red flags, if you have 4 strong LORs, which are specialty specific, we do recommend putting in 4. So if you put in 4, that'll be very good. But a lot of you may not have done 4 months of USCE. So 3 is bare minimum that is required. Okay. Now, before I move on to Mohammed, I do want to take a couple of questions. How to ask for LORs when attending changes every week during a 4-week rotation? This is a very important question. I am doing rotations at a hospital and the attending changes. What can I do? Right. So one option would be many times they can combine the LOR. So if you are in good books of the attendings, you can ask one attending that I rotated for 1 week with person X, then person Y. Would you be willing to get all their feedbacks and give me one LOR? Sometimes that is possible. Otherwise, of course, you can get from the individual attending, but I see the point that 1 week LOR is not that strong enough. Another question is LOR from a subspecialty good enough? Yes, absolutely, especially when it comes to internal medicine or any other specialty that have subspecialty. It is all right, and it is actually recommended to get a subspecialty rotation and LOR. So, for example, GI, Hem-Onc, cardiology, ID, all these rotations work well for IM. And if you're still looking for rotations in the next 2 months, my team can put links for the rotations. So whether it's Antara, I don't know who's joining, but she can put the links, and you can look at the rotations which are available, including many telerotations, if this is something you are looking towards the end. So Antara, if you can post the link for the rotations. If we upload 4 LORs, should it all be US LORs? Should it be uploading home country LORs as well? So in general, 4 US LORs. However, there are exceptions. So let's say you're a recent graduate who's a gold medalist. Okay. Then home country LOR is acceptable. If you have a home country residency that just finished, then 1 home country LOR is acceptable. Okay. Is doing 3 to 4 same subspecialty rotations okay? So I'm assuming the question is, I'm applying for internal medicine. Can I do 3 or 4 cardiology rotations? So that is something I would really want to avoid, because that creates some kind of a confusion with the program director that maybe you are only looking for cardiology, for example, and the program may not have their own in-house fellowship in cardiology, and also avoid that. Do rotations that are spread across geographies, subspecialties, and even cities. Let's talk about LORs. Okay. What are the 2 types of LOR? So all of you first should know there are 2 types of LOR: waived LORs and unwaived LOR. Waived LOR means technically you have not seen the content of the LOR and the preceptor has uploaded it directly. So that is the definition. And all of you should always have a waived LOR. Unwaived LOR means that you have seen the content and that has no value. Let me repeat, unwaived LORs have 0 value. If you have an unwaived LOR, there is still time to change it. Of course, all our rotations preceptors give waived LORs. What are the strongest letters of recommendation? So let me ask you, what do you think are strong LORs? What constitutes a strong LOR? Last question before we go to Mohammed. So if you want to type what you think is a strong LOR. Anyone who wants to talk about a strong LOR? So yes, you can type in what is a strong LOR, and please put it to everyone in the chat, not just to panelists. So what is a strong LOR? Okay, so Sapna is saying personalized, contextual, specific with example. Yes, absolutely. Personalized from a department chair. Well, if you've done rotation with a department chair, then yes. And that is one of the things I want to bring out. LOR should be from someone who knows you well professionally. So you may not have rotated with a department chair. On a university letterhead, yes, absolutely. Something that highlights your strengths, not something general. Yes, absolutely. That's always a good point. So those are the things. Absolutely. We will go over it, and maybe I'll have a poll also if we have time towards the end. So Mohammed, why don't you take it away from here, and then we'll talk about it. So why don't you introduce yourself, and then we'll go from there.
Hello, everyone. Yeah. I'm Muhammad Awais. I'm a 4th year medical student from Pakistan, and I recently completed a hands-on clinical elective through Sarthi at a pulmonology clinic in Irvine, California. So what I'm here to talk about is I just want to share some quick insights from what my personal experience was. Specifically, how do you know that your elective has been successful? How to make the most from your elective? And how important your LOR really is. So what makes your elective successful? For me personally, a successful elective is when you don't just show up and observe, but you're actually participating. A successful elective should challenge you clinically, get you involved in the patient care, and allows you to build real connections with the patients and with the staff you're working with. Because Let me speak from my experience. When I personally showed up, the first few days I was a bit nervous, obviously, so I wasn't really contributed much. So the program director there, he had me shadowing, so I was shadowing and just taking histories. But as I grew more confident in the first few days, I asked if I can contribute more, and he let me take over more. I could write soap notes, assist with procedures, and even started shadowing him at night with his ICU rounds. Now if I had not shown the confidence to ask for more, he would just had me shadow him through the whole time. And that's how you know if you're walking away with more than you needed. If you are satisfied with what you're getting, you know you're having successful elective. So, what are the types of USC experience you can have? You can divide USC into multiple types. There are obviously, as you know, observerships, research rotations, or hands-on clinical elective. Now, hands-on is what you mostly want because program directors mostly are looking for how you can fit in the US medical system, which you can prove through your hands-on LORs and clinical electives. As if when you're working with hands-on, you're working with the electronic health records, you're participating in the care plans, you're understanding insurance, and helpfully also working with prior roads. So you know what the system is, how to work with them, and especially you know how to communicate with patients. In US, it's not like our own countries. The patients are very culturally diverse. They're patients from abroad, they're patients from multiple nationalities. Sometimes you need translators with them. They don't speak English. So these are the kind of experiences that make you residency ready. So personally, the best type of USC you can have is where you're actively participating and it's hands-on. Now for you, the best type would be, as Dr. Parvan previously said, in your own field, so you can experience your field and your PD can know that you're ready to enter the residency you already are applying for. Lastly, before I leave, about LORs. They matter more than you can actually realize. Scores are numbers, but in the US, they're not really looking at your numbers. Numbers are important, but they're taking a more holistic review. So your LORs play more important part than you realize. They want to know your personality. The doctors there, the residents, they want to know if you're the incoming residents, they'll fit in, if you are fit for the culture. The LOR can show them if you can fit with their team and if they personally want you to be on their team. So you can get a strong LOR only, as I said before, if you're showing effort, initiative, and curiosity during a rotation. So always treat it informally. You personally can treat it like a month-long interview, if I can say that, because you can showing yourself off to the doctors there so they can write about you personally in the LOR. I think that's all I needed to say here.
Well, thank you. Thank you very much, Mohammed. Much appreciate your insights into how to take initiative in a rotation, the types of rotations, and what IMGs should be doing, especially those who are not familiar with the cultural nuances of this country. So thank you. Thank you for your time.
Of
Appreciate it.
course. Thank you.
All right. Well, it's my pleasure to welcome Dr. Parekh, Dr. Parinda Parekh, and she has been working with Sarthi students for several years, and she treats them all like her own family. Not only she helps them with rotations, of course, but also research, and she even hosts them. So one of the very best rotations that we have is with her, and we wanted to invite her. So Dr. Parekh, thank you for your time. Appreciate your coming. And one of the main topics for today, just for you as you introduce yourself, is we wanted to know what happens when a student is not doing well. What type of students don't do well, and then how can we improve? We hear a lot about how to do well, but why do students struggle in their USC is the main theme for today. So welcome, and if you could introduce yourself and then take it away.
Absolutely, Mr. Kara. First, I will take a minute before I introduce myself to really compliment you and your team, because at this point I've had over 28 students over the course of last few years, and I can tell you that your agency is perhaps one of the only organized, well-structured, responsive agency helping these students. So really, it's commendable job you're doing, and keep it up, because over the course of last few months, I've come across other, online, offline agencies, and really it's been disappointing experience. So really, whatever you're doing. So for the team to know, my name is Dr. Parinda Parekh. I'm a board certified child, adolescent, adult psychiatrist. I am Cornell trained, New York Presbyterian Hospital, Weill Cornell Medical College. I've been there as a faculty since 2002. So a couple of decades now, where I was the chief of eating disorder division, chief of emergency room here. I've been in Westchester, and now I'm in full-time private practice. I'm a medical director of OMH, Office of Mental Health Clinic, which is a large clinic. We serve about over 5,000 patients. I have my private practice where I supervise other residents, PAs, NPs, other doctors, and I've written book chapters, done extensive research. And one of the privileges that I actually enjoy working with the Sarthi doctors coming to me is really the opportunity to teach them how to do research. And I'll talk a little bit more about it. Because I think, look, as I tell every student coming here, so you said, what are the root causes of them facing challenges? I remind each and every student from any of these countries that they have earned their feather. They've been through undergrad or high school. They've finished their medical school. And I really want them to understand that their struggles are rarely due to lack of intelligence or lack of motivation. They would not be this far without either one of those qualities. Instead, I think they often stem from deeper, more systemic, more psychological or educational issues. So here, what I've come across. So most students coming to me first, they've never written a single publication in their life. They've never done any peer-reviewed work, which I think is a systems problem because during my undergrad here in America, during my medical school here, even Cornell initial attending years, but we had to write papers. We had to write peer-reviewed papers and we had to publish them. That's how we would go from instructor level to assistant clinical to then associate clinical professor positions. So I think lack of structured guidance, one, is a huge problem, where I think these rotations often lack clear expectation or structured teachings. Students are kind of expected to learn by osmosis, like what Mohammed said. So unless you show some initiative, it really doesn't get handed to you. So this can be quite inefficient and stressful. It is confusing, it is frustrating, it is inconsistent learning experience. So as you look for these rotations, look for structured guidance. Keep in mind that these are all high stress environments. Students following me, we joke how when they, especially when I am hosting them, and I'll say, you'll never see Dr. Parikh like this in office, because it is a high sort of stressful environment. They are in unfamiliar situations. Patients are critically ill, sometimes psychotic, sometimes manic, sometimes demanding. Sometimes colleagues are demanding. So there is a lot of that burnout, anxiety, loss of confidence that happens. And that, by the way, brings me to a bigger point, which I find across the board, that these students are sharp as whiz with their knowledge, yet what I think they have imposter syndrome, right? What do I mean by that? They actually have low confidence. They feel inadequate compared to other residents, compared to other doctors. And sometimes you will actually have an overconfident student who is not that great, kind of bulldoze these good, competent, capable doctors. So one of the things I do in my rotation, and you can ask any single student who's finished my rotation, that it is really about personality development. It's really about starting to trust yourself. And I help them through their self-esteem, their confidence. I actually instigate them to ask questions because they're afraid to ask questions. I instigate them to participate because learning, remember, is a lifelong process. It is not limited to your step 1, step 2, step 3. This will continue long after you've done your scored exams. And like Mohammed said, and Mr. Kara said, the scores are important, but it's really how you interact with your environment, conduct yourself is very, very important. What happens with these exams, they make us good memorizers, right? So we focus on memorizing facts rather than understanding how to apply knowledge to real life patients. So I'll frequently have a doctor who will have a whole script of what questions to ask, but they will miss the social reciprocity or the communication with the patient. So those are things that I think are very important to work on while you're doing these rotations. And timely feedback is very important, because if you don't ask for feedback, they will not give it to you, right? Your supervisors. So feedback sometimes is very vague, it's delayed, or it's entirely absent. You need real time feedback, because you need to know whether or not you're doing well. You need to know, if you're not doing well, how do I rectify this, right? So as I said, my 4 points, have a structured orientation, clear expectation of your rotation. Look for teaching culture, very, very important, because what separates, of course, scores are important, but guess what? Out of 1,000 applicants, what separates you from the other 999 really is when you have that 7, 8, 10, 12 research papers. Also, teamwork, collaborative work is very important. Every student coming to my rotation, they know day one, this is not a competition. This is actually cooperation. This is a collaboration. So the way it works is, when I have 6 students, each one of them is mandated, expected to write 2 papers, but again, their name goes on every single paper in that group for month of May or month of June or month of July. So they walk away with 7, 8, 9, 10, 12 papers. Some of the kids actually ended up working very, very hard, and they ended up getting almost 23, 24 papers over the course of their summer experience. So really look for active teaching culture. This is really not about just getting LOR. Somebody asked me the other day about the LOR. I said, that's least of your problem. Show me your work and I'll write to the LOR that someone cannot refuse you. And to give you some concrete information, Mr. Kara, 6 out of 8 students that you had sent actually started their residency this year from our 2024 group. So that's commendable, remarkable. At the same time, look for a placement where it really offers you, like I said, that mental health support, mentorship, encouraging team inclusion, and really put yourself out there. The more you put yourself out there, the more you'll get. And be open to feedback, constructive, what may feel like not so constructive, but it is a feedback, really. And then use all these to really have self-directed learning, because long after you're done with your numbers and scores, you really have to, it comes down to really being able to have communication with your colleagues, with your patients, and at the end of the interview, but come up with the right diagnosis and right treatment. So really, I think these clinical rotations that Sarthi really have provided you or will be providing you are a critical bridge between your textbook learning and real world medicine. And struggle often for most students, it really lies not in the complexity of the medical information, medicine itself, but it's really in lack of support and structure and belongingness. So really address these root causes, and you will really have tremendous growth, both for the students as well as Sarthi as an institution.
Well, thank you very much, Dr. Parekh. And one of your students who's in the chat is saying that it was your rotation was one of the best experiences for her studies. So absolutely, I think your rotations and research experiences are one of the best. So thank you for your time. And Antara, if you want to post Dr. Parinda's rotation link, so for students who are still interested, can take a look, and then we'll go from there. But thank you, Dr. Parekh, for your time. Thank you very much.
Absolute pleasure. Continue the great work.
Thank you. Bye. So let's continue on in terms of the USCE and rotation. And before we move on, for those of you who are still looking, I just wanted to tell you how to look for rotations on our website. So let me just share this screen so that you can all see very, very quickly. So for the first up is, many of you going into the match have told us that, some of the plans are expensive, and you're looking for something very, very affordable. So this is a new plan. You can take a look on our website, ERAS CV Plus, where we actually review your personal statement. ERAS CV, you sit down one-on-one with our physician, who's either an attending, a resident, or a fellow, on Zoom, and they go over your PS and CV. It also goes through the journalist review. You also get a program list and some of the classes associated with it. So one of the very affordable plans, IRAS CV Plus, if you are just on a very tight budget. Then, of course, the second plan is the Turbo Match. It gives you all classes and everything in the IRAS CV Plus. Of course, you sit down with a physician and all of that, but you get all digital access, interview prep, how to signal programs, geographic preferences. Every class that we have for gold or platinum is part of the Turbo Match plan. So take a look at that. In terms of clinical rotation, so for those of you still looking in the next 2 months, so we still have space for clinical rotations. If you go on this rotations page, and Antra, you can post a link to this page. If you go on this clinical rotations page, you can actually click here where it says need rotation soon, check out the rotations. It'll give you a full list of all Sarthi rotations in a Google Excel sheet, and you can click on any of these. You can read the description, you can see the LOR type, you can see whether they are telerotations or otherwise, and some of the rotations are actually also giving discounts which are mentioned here. So you can look at the setting, you can look at the discounts. Again, it's all on our website. If you go to clinical rotations and click on the Sarthi rotations list, in one shot you can see the rotations. With that, I will come back to some of the questions, but let me take one quick questions that someone raised, and Aarti, you can take it from them. So this is Mehmet, who's saying that I did a rotation with Sarthi, final year med school student from Turkey, but did not get an LOR. So we will follow up with the physician. They should get an LOR to you, but Mehmet, you will have to have an account on my IRAS. So, but Aarti, if you want to follow up with Mehmet, so Mehmet, if you want to email us your full name, email, and we'll pull the rotation that you did, and we'll absolutely get you an LOR. Okay. All right, let's move on. Our next speaker is Manali Desai, one of our students. So Manali, welcome. And glad you are able to help other IMGs. So why don't you introduce yourself and then talk about, USCE and how to get good LORs.
Well, thank you for inviting me to this session. My name is Manali Desai. I did my medical school from India. Then I did MPH from Texas A&M College Station. Now I am PhD student at the UT School of Public Health, Houston. And I'm working as a research assistant in MD Anderson Cancer Center. I am doing rotation right now. I am in Middletown doing family medicine rotation. For letter of recommendations, my suggestion is to start writing early, have a draft, and start writing it as soon as you begin the rotation, so that you have time to revise it. So usually, what I do is I start writing it early. I make the draft, and then I take feedback from the professor at the end of every week, so that there is time to revise it. And you will have, and that gives an opportunity to have like a original draft instead of a generic LOR. With this strategy, it's possible to have some points which you did during the rotation, you will be able to mention them. Apart from this, depending on the rotation, if you're able to do a PowerPoint presentation, mention that. If you're able to do a case report, a quality improvement project, mention this in the LORs. So that is going to make the LOR like a special LOR, tailored LOR, which is for you. Yeah, these are the suggestions from my side.
Thank you, Manali. Any feedback on the rotations that you have done so far? What have you learned? how can students do well in rotations based on your experience?
One thing is about communication. Develop, like, don't wait until the last week to approach the professors and the doctors to get feedback, or just to like introduce to them and talk to them. So in my experience, I feel like the first 3-4 days, those are the days where um, taking the initiative to go to them and talk to them, ask questions, or just follow up questions regarding the cases which we see during the day. So the baseline is that don't wait until the last week to approach them, because then it will be like you're going to them for letter of recommendation. Instead of that, start early, start the interaction early, start communication early, let them know about your plans, know about their plans, get feedback. So in this way, it's possible to make the most out of the rotation.
Yeah. Well, thank you. Thank you very much, Manali. Appreciate your time and good luck in the upcoming match.
Thank you.
Okay. All right. So, what I wanted to do next as we move on, so we will take questions. So, let me take some questions. For a rotation that I did last year, how do I follow up now? So, if you're looking for an LOR, and of course, if it is a Sarthi rotation, you can drop us an email at enroll, ENROLL, enroll at USMLESarthi.com. And Arti, maybe you can type that email also, and we will follow up with the physician if you haven't gotten the LOR. Is it possible to have hands-on clinical electives in the US after you've finished final year MBBS? So there are two things. If you have not done your internship, then of course you're still a student, you can do electives. If you have finished your internship, you're a graduate, you can still do externships. Okay. So remember that you can still do hands-on in the US after you graduate. Okay. So before I move on, let me also, for those of you, we do have an Instagram account. Of course, if you follow us on Instagram, all these updates we post on Instagram. So make sure to, do that. So Instagram, and make sure, so Antra can and put those links. So we have a YouTube channel also. So Antara, if you can put both the YouTube channel and Instagram. Then we also run a free Telegram group, right? So if you join our open Telegram group, that's where our math students and panelists are answering your questions. LinkedIn, of course, we run a group on LinkedIn, we run a group on Facebook. So all of this is to help you. Of course, our math services are different. So that's, we can also talk about that. Okay. So before I move on to other questions, there are things that I wanted to talk about LOR. So we also spoke about strong LORs, so it has to be very, very specialty specific. It should talk about what you have done. It should be personalized. Now let's talk about some of the mistakes you should avoid. So anyone who can write down mistakes to avoid in LORs. So what do you think are mistakes if you've seen other LORs? If you've written your own LOR, sometimes that happens. What are the mistakes you should avoid? Yes, Mehmet is saying ChatGPT generated LOR. Absolutely. Program directors can easily figure out nowadays what is ChatGPT, what is a personalized, written by a attending. So yes, that's the biggest mistake. A lot of you should avoid the AI generated LORs. What else? What are the other mistakes? Too generic. Okay. What else is something that you may have seen, heard on the LORs that are just plain bad. Grammar, yes, absolutely. A basic thing, but a lot of us don't realize that grammar, punctuations, all of these are very, very basic things. And frankly, for grammar, for punctuation, you should use Chat GPT, right? So grammar is something that is very ingrained. It is basic. You should be able to fix that. Too short. Yes, I've seen LORs that are one paragraph. So very short LORs are absolutely something which they don't even consider. Negative feedback. Yes, but I will tell you in this country, they don't give negative feedback in an LOR, very, very rare. They will give average, but negative, yes. If you think you will get negative feedback, don't even ask for an LOR. LOR without signature, letterhead, etc. Technical stuff. Absolutely. This is a very important point. LOR letterhead matters, and clinic letterheads have less value than hospital letterhead. So make sure if you are doing even Sarthi rotation, check for the letterhead in the description. What kind of letterhead are you getting? Of course, a clinic letterhead would mean slightly cheaper rotation, but you should know what letterhead you are getting. Yes, the LOR has to be signed off, but you won't know that when they upload. But yes, all those technical stuff need to be taken care of. Is it too positive? That's another mistake. What I have seen, and thank you for bringing it up, Shahid. LORs tend to make you a Superman or a Superwoman. It will list you 15 qualities, hardworking, punctual, good with patients, good with team, and, all the 15 qualities. No one can show 15 qualities in one 4-week rotation. And then what happens in such LORs is they miss the personalized example. So too much positivity, 15 good qualities in an LOR is also a red flag. Okay. So those are the things, some of the things, but let's move on and talk about some other things that you should be, careful on when it comes to LORs. Okay. So the other things in LORs is the use of action words. Again, this is talking when you have an opportunity to draft your LORs and, maybe the attending is saying, okay, give me some bullet points or give me something you did and I'll draft my LOR. So that's another thing that many of you may miss. So I want to ask you, what are action verbs? How do you use action verbs in an LOR? Give me some example of action verbs. Anyone has examples of action verbs? Initiative, yes, took initiative, for example, is a good action verb. It shows proactiveness, initiative. Yes. What else is an action verb? Collaborated, yes, of course. In this country, teamwork, collaboration is big. Good. What else? Any other examples? So performed, conducted, diagnosed, demonstrated, executed, examined. There are led a team is always, led a family meeting. So all these things show action work. Hardworking is not something you want to, you want to show, don't tell. So when it comes to an LOR talking about your hard work skills, they have to give it with an example. Okay. He taught. Okay. Taught would be a good one. Helped is not really, you could be helping a lot. Okay. So let's do an exercise. What I'm going to do is I'm going to show you an LOR. All right. And maybe we'll just look at the first couple of paragraphs and you can tell, what mistakes you have seen. Okay. Or how will you improve it. And this is something we teach in our classes. So those of you interested in joining our gold, platinum, or bronze plan, or even turbo plan, take a look at that, because this is exactly what we do in our classes. So let me share LOR. Obviously, names are scrubbed and all. So take a look on the first 2-3 paragraphs that you can see and note down, and then you can put it in the chat on the quality of this LOR. Assume this LOR goes, it's a waved LOR. Assume that this would be the LOR that goes to the in your eras, and the PD looks at it. Maybe look at the first few lines till here, right? Take a couple of minutes. I want you to read it. Hopefully you can see it, right? Then we'll talk about how you can do it better. Okay, so hopefully you read it. Give me some things what you figured out from this LOR. If this were your LOR, forget the specialty. Is it a good one? What would you do to improve it? Things like that. What did you see? Okay, needs improvement. What kind of improvement? Okay, someone is saying it seems pretty good. Unfortunately, you cannot speak. You'll have to type. And next time, if you want to speak, we'll have to get you on as a speaker. Repeated enthusiasm in the first paragraph. Okay. What else? High level, what do you see in the first few paragraphs? First paragraph should be separated into several paragraphs. Example of busy OPT was good. Okay. Yes. Needs to mention not only characteristics but elaborate them. Very good feedback. Yes, absolutely. And I'll come to that. Does not look realistic. Okay, Prem, why doesn't it look realistic? Looks like ChatGPT wrote it. Probably, you're right. Mentioned example of the work, not just quality the doctor has. Absolutely. Over enthusiasm. Okay. More specific example. It is punctuation is less. Okay. So grammar. Okay. Good. So let me now show you some of the things that we caught. One of us reviewed it. It's not the all, and I will tell you. So first, of course, is grammar, right? So the name has been removed, etc. The grammar has to be good, and in that case, there were a lot of grammar issue. One of the main things here was lack of example. So you probably will not see here, but even below, she said the doctor said she got significant inpatient exposure, but that's just one line. There was no articulation, experience, or example of what it means, right? So the example was missing. Counseling, bedside, again, that example was missing. How actually she helped. Example of maybe teamwork. Clinical skills could have been much better. This one just showed, documentation in the EMR and all of that, right? So again, too many qualities, and I'm not going into the grammar. We fixed the grammar and all of that. We gave them good feedback and all of this. So too many qualities, like you said, someone said chat GPT or, just all of that. Correct. Too many qualities. Remember, not every quality will be demonstrated in a 4-week rotation. That was a big thing. And you had to have just 2 or 3 examples here. One may be inpatient setting. The other is clinical skills. The other is maybe counseling. How do you counsel? Like here, I think we had a feedback also. Specific example with a patient, paying attention to patient, maybe when they were scared or apprehensive, maybe family. So that kind of specific examples were missing. So these are some of the things that you absolutely have to get in the LOR correct. And that is, again, things that we do in our classes. So, you know, Antra can post a link to our classes. You can take a look at some of the trailers of what we do in our classes, very specific feedback and how you can improve every aspect of the match, whether it is an LOR, whether it is your USCE experience, what research you need, what rotations you need. The other thing I did want to point out is there is still time for those of you who are going into the match to do rotations and research. So, our courses on research can still get you submitted, not published, submitted in the next 2 months. So, whether it is the concept to publication course, so if you look at this on our website, and Antra can post a link. This is Dr. Weissman, who was supposed to join today, but he couldn't join. So, you can look at the calendar. We are going to work on a manuscript in August, manuscript in September. Both of them will be submitted, and you can put it in IRAS as your publication. So that will be done. The CIBNP research also will be finished in 1 month. So fast track research program, in 1 month, you can get 2 first author papers, and this will also be submitted and done in a month. So for those of you still looking to complete research, this is a good option as well. Okay. So that said, let me get our next speaker, Dr. Amit Korea. He's also been taking a lot of Sarthi students over the past few years. He has had great experience, and his rotation is one of the well thought out, and he structures it very well known rotations, and he helps the students a lot. So, Dr. Korea, welcome. If you're around. Okay, maybe is just fixing his technology. Let me take. Okay, I think he's here. Amit, are you there?
Yes, I'm there. How are you all doing?
Yeah, thank you. If you can get your camera on. So, we've been talking today about obviously how things that IMGs don't do well in their rotations, or what you've seen IMGs can improve upon in their rotations to earn a good LOR. What are the improvement opportunities that you feel IMGs should be doing? So first, if you could introduce yourself. Second, your experiences with the students that we've been sending you, in general. And third, how can they improve?
Hello, Pawan. Thanks for that introduction. Great talking to all of you. So I'm the Dr. Korea, and I'm the Director of Hematology at the University of Texas in Houston. And I'm also going to be one of the Associate Program Directors for the Fellowship in Hematology and Oncology. So that gives me a chance to review a lot of applications for students applying for fellowships. I get a chance to look at the letters of recommendation and things like that. And so I think to start off with some basic housekeeping points, one is that I have some students rotate with me, and they communicate with me, for example, through WhatsApp, right? And they never have their picture on their WhatsApp. So let's say 4 months later, you're communicating with your attending, and it becomes if without a face, it becomes very difficult to know who I'm dealing with. So just some housekeeping points. Make sure that your WhatsApp profile or your email always has a formal picture of you, not a picture of a garden, not a picture of a rose, not a picture of any monument, but has your picture, a formal picture of yours, ideally in a suit. It gives a very, very good impression. That's one. The second thing is, again, a housekeeping point. A lot of students rotate with me, and you know how we Indians are, we have 5 or 6 names, right? Someone's name is Sai, Sudarshan, Reddy, something, right? And what happens is, be consistent with how you name yourself, right? I've had students who are at my rotation call themselves Sai, and then I spoke to someone else at another rotation, or they are going as Reddy. I think it's very, very, because you're trying to network. The whole idea of a rotation is to network. The whole idea of a rotation is, if your name is Sai, when your name comes up, two attendings talking about you in two different institutions should be able to say, let Sai rotate with me, I know Sai. Versus if you're going as Sai over here, you're going as Reddy over there, you're going as whatever other name someplace else. So if you have 5 or 6 names in your name, for whatever reason it is, be very firm that this is going to be my name that I'm going to go with, and make sure that in your WhatsApp profile, in your email, you always put what your name is, and then you can put your name down below that, so everyone knows who they are dealing with. Like, for another example is, I had a student from China rotating with me the other day, and then they have long names as well, and he tells me that he goes as Blake, right? And then I asked him, I said, I looked at your name and I don't see Blake anywhere in your name. And he tells me that, well, I just decided that this name sounds good. So I said, at your last rotation, which name did you go as? He said, I went as John. I mean, just because John and Blake sound good. I mean, imagine we are talking about the student when we're making a rank order list a year and a half, 2 years from now. First of all, we're not able to connect Blake with his name because it's nowhere in his name. And then he's going as John in one rotation and Blake in the other, right? So just some housekeeping points. Make sure you don't do any of that stupidity so that everyone can recognize you for the next 2, 3, 4 years. And some of my students are now reaching out to me for fellowship applications. Now, if it is a long time, right? Because from when they did rotations with me to when they're applying for fellowship is about 4 years. And some of the students are really good and I remember them, but you should do all you can to make sure people remember you and not actually do things on the contrary, right? So that's what I would suggest. The other thing is, with regard to the rotation, I think that's what's very important is to be a team player, right? If the attending is telling you to do something, first of all, make sure you're on time, right? If the attending says we're going to start rounds at 11:30, please do not show up at 11:45. That's a very good way of being recognized and remembered, but in a negative sense, right? So that's really not going to help you down the road. So make sure you're on time for all your rotations. The other thing I've noticed is, if the attending tells you that you need to show up in a particular attire, if it's scrubs, if it's a lab coat, if it's a stethoscope, you need to show up in the right attire. You cannot just show up. I've had students show up in flip flops. I've had students show up without scrubs. I have a student show up without lab coats. I mean, those are things that, these are just basic housekeeping points, and you really, really should not be messing these up. These are just absolute basics, right? When you're showing up for a rotation, come with a notebook where you can make notes about the patients that you see, right? The other thing is, when rounds are going on, don't interrupt the attending right in the middle of rounds. We are rounding on 20 patients. We have fellows from MD Anderson. We have residents. It's a very intense discussion going on. And oftentimes it's above the scope of a medical student. So what you should be doing is you should be making notes at that time. And after rounds, you can come and address that with the attending and say, you all spoke about these things at rounds. What does it mean? Should not. Again, these are basic housekeeping points. Rounds are going on. You're talking about an intense case. Everyone's kind of in deep thought. And then you bring up some, a basic question as far as the team is concerned, which is a super specialized team. Maybe it's an okay question with being a medical student, but in the context of what's going on, it's really not the valid question to ask. So again, have a notebook, write the name of the patient down, say this is the doubt I had. After rounds, you can address that with the attending. So I think just some basic housekeeping points are very important. In addition to that, any work that has been given to you, and the simplest thing that we do is, I'm seeing a patient with cancer. The patient was, let's say, at Methodist Hospital a month before this, and I tell you, can you call Methodist Hospital and get the records on this patient, right? I've told students that. Next day I asked them on rounds, I'm like, hey, did you call the hospital? Do you have the records? Oh no, we forgot. Now, those things, again, are just basic housekeeping points. When you're on the team, you want to be as helpful, as much of an addition as possible. You should think about it this way. How can I make work light for everyone on the team? Is there some task I can pick up to help everyone? Let's say there's a patient who doesn't have insurance, and we say, let's go and talk to the social worker. And I assign one of the students and say, talk to the social worker and figure out how we can get this patient insurance. Again, not a very cerebral task to do, but in the context of what we are doing, it's important because it's going to determine, can the patient be seen as an outpatient, what plan should we have for the patient when the patient gets discharged from the hospital, so things like that. So make sure you make yourself as helpful to the team as a whole. You don't have to come in here and answer some very difficult question and things like that. The whole idea over here is, one is, do you have the aptitude to be a good team player, right? Because when people reach out to me many years later or a year and a half later, most of the program directors will ask me this question: will he fit in well in our team, right? And the answer to that is how two things. One is, how well have you helped everyone in the team and helped the team become a better place? Two, how enthusiastic are you to learn? It's not what you know at that point, but how much you want to learn. If you're seeing a patient on CAR T cells and I'm telling you that, look for signs of ICANS or CRS, I cannot sit there and tell you what is ICANS and CRS. But what you should be doing is you should be going home, reading about ICANS and CRS, and next day when you're following this patient, you should tell me, doctor, this is what ICANS and CRS is. I evaluated the patient this way, and this is how my conclusion, right? So everything cannot be fed to you, but just small things that are said or addressed with you or told to you, it is your duty to then go back and read. So that shows that you're wanting to learn, you're enthusiastic, you have that sponge kind of mentality, that you're ready to learn. So I think those are the very, very important things on a rotation. Not heroism, but just basic housekeeping, making sure you're part of the team and making sure you have that sponge type mentality where you're ready to learn and you're always wanting to learn. I think that's the most important thing as far as getting a good letter of recommendation is concerned. That's one. The other thing is, with regard to the letters of recommendation, I get emails all the time from program directors once they interview you, once they're making the rank order list. So they obviously want a letter from a university, an actual university, not an affiliation. They want a letter where someone's worked in an inpatient setting, outpatient setting, and a stressful inpatient setting, right? So when you work with me, that gives me the opportunity to see how you all work in that setting and then report back to a program director that, yes, I had evaluated the patient in the inpatient setting, outpatient setting. I evaluated them in a high pressure environment. And the fourth thing is, I've evaluated them with regard to their conduct with the rest of the team. That is the nurse managers, that is a social worker, that is a case manager, that is the other medical students on the team. So they want to know how you interact, not just with the fellow and the attending, because obviously you're going to be very nice to the fellow and the attending. But when you're a resident, you're going to be interacting with everyone else on the team as well. So make sure those interactions are very, very respectful. And they should be like you talk to the attending with respect. You should have that same respect when you talk to the other members on the team, be it the social worker, be it the case manager, be it the nurse, or anyone. Okay, so those are the basic housekeeping points I have. I think there's nothing to stress out about on a rotation, but just stick to the basics. Just think, let me just do the right thing. Don't get involved in, should I be reading about acute lymphoblastic leukemia? Should I know about the latest treatment for acute lymphoblastic leukemia? Should I know about CAR T cells? I mean, you're in a super specialized rotation, right? I've gone through 7 or 8 years of training post medical school to get to this point, right? So my expectation of you is nowhere close to know what we are talking about. Okay.
Well, thank you, Dr. Korea. And for those of you interested in rotation with Dr. Korea, Antara is going to give you the link. So we still have some spots for this season if you're interested. Otherwise, of course, starting October, November, or tele or on-site rotation. So Antara, if you can post that link. So thank you again, Dr. Korea. I think this was very, very helpful. What not to do and the basics of just how to carry yourself in this country, I think are very, very important. So thank you for your time.
Thank you so much. And the other thing is that what I'm trying to now get on the rotation is I'm trying to get you all abstract published or a good case report published. So that's something that I'm working on. And I think for the last 6 months, all of you all who have rotated with me have got an abstract or a case report published. So I think that really helps with regard to your application. And then that gives me the opportunity to write in your letter of recommendation about your scientific acumen and your desire to work towards the improvement of medicine.
Well, thank you, Dr. Korea. Thank you and appreciate you taking time on a Sunday for us.
All righty. Thank you. Thank you, everyone.
Thank you. All right, so let's move on. So I'll answer some questions. By the way, if you are interested, Antra has just put on a link. So if you want to set up a session with our team, that's fine too. It's a free session that you can take. Just we'll tell you where you need to work on, etc. So in the last few minutes, if there are questions, I will take. Length of an ideal LOR, if it's a 4-week rotation, it can be a page. If you have done maybe 6 months to 1 year, there are times when you do research rotations, there are other things, then I think 2+ pages with specific examples. So length of an LOR varies, but it also depends on the duration of your rotation. Any other question that I can answer? Okay, is LOR review included in TurboMatch? So that's a very good question. We are including free review of 1 LOR in the TurboMatch. So if you are interested, Jerish, if you want to join us, yes, we'll give you a free LOR review. Just email enroll@usmlesarthi.com. And if you enroll, we will definitely do that. Is IMSCL or chair letter necessary for an IMG? No, it is not required. SLOE is required for some specialties, but in IM, you are better off using 4 US LORs. Can 2 LORs be from 2 different doctors in the same hospital if I work with 2 doctors? Yes, of course, it can be the case. You've worked with 2 separate doctors, getting 2 LORs is fine. If LOR is waived, can we see it? Well, it depends on the preceptor. Sometimes they give you a draft, sometimes they don't. It is up to them. Technically, you cannot see it. Interventional radiology PD, can they write an IM or FM letter? It's not about writing the letter, it is about the work you did, right? So interventional radiology, how will that be linked to your IM experience or FM experience? I think that is the key. If they can do it, probably yes, but my recommendation would be to go to a IM board certified or to go to a rotation which has IM or FM kind of experiences. Any recommendations to practice clinical skills, or is there any course for clinical skills to review before a rotation? Unfortunately, we don't have a course on how to review your clinical skills. Do home country LORs count if someone does not have USCE before October? My suggestion is, if you don't have USCE on site, get Tele USCE. Tele USCE is still better than home country LOR. Can I get my LOR reviewed with gold plan? Depending on when you signed, send us an email. We can take a look, Mohammed. But if you've not signed up, yes, we can definitely get you the LOR reviewed. Does Sarthi have a program for all the application process? Yes, absolutely. Starting from your mentorship of your exam. So step 1, step 2. So not tutorship, mentorship. And then, of course, when to do rotations, what type of rotations, research, and then the entire match. So yes, Sarthi can help you with all phases of the match. I completed inpatient rotation through Sarthi for a family medicine doctor working as a hospitalist. Can I use this for IM? So Naresh, get in touch with that physician, tell them that you are going to apply for IM, and maybe they can tweak that LOR. Are there different requirements for LOR content if applicant wants highly competitive residencies such as surgery? So, the basics remain the same. Surgery, look at what surgery is looking for. Extreme hands-on experiences, maybe strong research. So the basics, what we discussed today, remain the same. Okay. I have already signed up for Gold Plan. Can you share the email where I need to send LOR for review? So, Mohammed, if you've signed up for Gold Plan, email Aditi, ADITI at USMLESarthi.com. She'll look at your plan and she will tell you the next step. The free LOR kind of review is only for the new students. Because, some students get one versus the other offer. So if doctor writes she shadows me, then mentions all hands-on experiences, is this considered incorrect? Yeah, from the looks of it, it is incorrect. Shadowing is different, hands-on is different. So that you may want to change it. Okay. What else? Are there any other questions that I missed? I am currently doing telerotations via Sarthi. Should I reach out to the attendings or the Sarthi team? So obviously LOR will be done after you have finished your telerotations. But yes, after you finish your telerotation, you will have to do both things to get it quickly. You obviously request directly to the attendings using the MyRA system, but also let my team know. So Aarti or Reshma or Asifa. So you let them know and we will also follow up. Okay. Does LOR has to be from a doctor? Well, yes. So clinical LORs have to be absolutely. So don't get it from a resident or a nurse practitioner or someone. Yes, it has to be a board certified, probably in the specialty that you are rotated in. And research can be separate. Of course, many students do research in a university. Someone who's a PhD, maybe a non-physician, that is acceptable. How is having all LORs from Indian origin doctors practicing in the US considered? So very good questions. And this question is applied to everyone, whether it is, the Indian student working with Indian physician, Nepali students working with Nepali physicians, Pakistani students working with Pakistani physicians. So the way it works is as follows. If they are working in a top university or top program, Mayo Clinic, Harvard, etc., I think that's fine. But if you have 4 clinic rotations and all of them, let's say you are an Indian and they are all Indian physicians in a clinic, independent clinic, then it is definitely not advisable. And same goes for other nationalities. Program directors can figure this out. What is the best time to do USCE after step 1 or step 2? I think between step 1 and CK is a very good time to do USCE, and especially if you can do your USCE between October and June, that is the best time. There are less students. You spend more time with the preceptor, you get more responsibility, you get to see more patients, and more responsibility means your LOR will be much, much better. Okay. With that, we come to an end of this session. So thank you all for joining, and we will be back soon with our next webinar in about 2 weeks, where we'll continue to talk about the season and how you can do better. I'll keep this open. If you're interested, again, join our YouTube group or our channel for more of these videos. Instagram, of course, is always there where we are answering your questions, and the Telegram group. And Antra can post the link for all of this. And like I said, there are still options for those of you interested in this season. So IRAS CV plan, which Antra just posted, is a good plan for those of you in budget. Turbo plan is a good one. So Antra can post the link to Turbo as well. And if you are interested in rotations or research, we can still help you. So Antra, if you can post the link to the Turbo plan as well, I think many students would want to take a look at Turbo and the IRAS CV as well. Okay. All right. Thank you. And I will see you next time.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.